I actually am a real doctor. In fact, I'm a doctor and a doctor. I'm a medical doctor, the kind Mom was proud of. I'm also a PhD, the kind Mom said, what was the point? But, what can you do? What can you do? She once says, I don't really understand what it is you do, but whatever you're doing, you're not doing it for the money. But here we are. I actually do work in the hospital about 5 to 6 weeks per year. I'm even on shift tomorrow. Just enough to be dangerous. To reassure you, I don't do surgery. I don't treat kids. Any other reason in hospital, be careful. You could get me. But just as serious as I take my time on stage with you here tonight, I also take very serious, I study medicine extensively because I want to make sure I'm a competent physician. Who knows a situation like Alan just described? You need the right people at the right time to be ready for you. So to actually demonstrate the kind of intensity here, I actually need someone who can help me read parts of a medical reference. Anybody here happen to be medicine trained, that would be even better. Otherwise, can I have you come on up?
Oh, me?
Or no, we got a volunteer? Yeah, let's get on up here. Get on up here.
Get up here.
Let's give her a big hand. That would actually work pretty well. Howdy, howdy, coming over to the side here. What was your name?
Kara.
Kara, so nice to meet you, Kara. Very good, I'm Jonathan. I got here, I don't know if this is familiar to you at all, this is called pocket medicine. Or are you in the medical field?
Yeah, kind of. I'm a midwife and I'm an acupuncturist.
Excellent, excellent. So there you go. So many of these terms are going to be familiar with you. It's going to be all sorts of acronyms, but we'll kind of figure it out. We used to call this our peripheral brain, where every doctor, every medical student is going to know what this thing is. We're doing our rounds in the hospital, and some senior physician is going to quiz us with what's going on, and we're going to try to level on a patient as we're frantically going to look at what's the diagnosis of treatment. This is how you figure out who is a good doctor, by how much of this all we learn. Kara, would you believe that I have memorized every page, every paragraph, every diagram, every sentence of this entire book?
I would, yeah.
Well, that was easy. Thanks so much, Kara. You can return it. Hang on a second. Extraordinary claims require extraordinary evidence. Kara, there are hundreds of pages of extremely dense medical information in here. Kara, could you go ahead and take the book?
Yeah.
Go ahead and open to any page you want. You got a book? What page are you on? Tell me what page number.
158.
158. 158. Look at the bottom. Look at the bottom of 158.
Mm-hmm.
And I believe you'll find the last words are pocket medicine. Kara does not seem adequately impressed. Right? It says pocket medicine on every page. And also, Kara, I can totally just see the page and sneak a peek here. We need to make this more fair and establish test conditions, Kara. Can I have you stand here and face this side of the stage? Here, come over here. And then I'm going to face the opposite way, so we're back to back now. This is important, Kara, because if I were trying to sneak a peek at the page here and turn over and look, you would see me. I'm trying to protect the book. What if I snuck over on this side and try to get in here? You would totally feel me, right? Don't let me see that book. You got it. So here we are, back to back, shoulder to shoulder, cheek to cheek, so to speak. Go ahead and open to the next page, Kara. You got a page open?
I do.
Go ahead and read us the title or the first line. What do you got?
The first line in the first paragraph says pharmacologic options if HTN or pre-HTN plus diabetes or renal disease.
Of course! This is like treatments for blood pressure, right? Yeah, so the next one gives an example. A treatment with an ARB, which is an angiotensin receptor blocker, can be used for treatment of prehypertension, prevents progression to HTN, but doesn't increase clinical events. What's at the bottom of the page? Is there a big table with like treatments for hypertensive crises? Is that what it has? It is. It lists all these options like nitroprusside, nitroglycerin, labetalol, hydralazine, esmolol, phenoldiazepam, nicardipine, phentolamine. Is that what it says?
Yes.
Is that impressive? Does that seem pretty cool? Go to the next page. That could have been a fluke. Go to the next page. What do you got on the next page?
Just another random page?
Yeah, just go forward a couple pages. What have you got? Read us the first line. Read us the title. What do you got?
Tailoring the ventilator.
Tailoring the ventilator settings. Oh, this is like if somebody's on a breathing machine, and is it like if you need to improve their oxygenation, you can increase their FiO2 or their PEEP? And if you increase FiO2 greater than 0.6, and there's still suboptimal oxygenation, you have to increase the PEEP. Look a few rows down. Is there like a bullet point for increasing the ventilation? You might want to increase the VT, tidal volume, or inspiratory pressure, or the RR, the respiratory. Be careful, you might have to decrease the I time. Is that what it says?
Yeah.
I mean, is that are you impressed yet?
Yes, we're
I'm very impressed.
There you go. Think about how much work this took. You want to do one more? Let's do one more. Take what's the next page? One more page. One more page. Let's do one more. Just one more. What do you got? Just turn to the next page. What's the next page?
Paroxysmal self-terminating versus persistent sustained.
Oh, hang on a second. Wait. What page number is this?
13.
Very good. Is that the atrial fibrillation page? It is. Okay. Yeah. Paroxysmal, and then next like valvular or non-valvular. Many different. There's like a diagram or workflow like thing in the middle, like yeah. And then the first branch to the right. If there's like an unstable patient, you do urgent cardioversion. Versus if they're stable, you go down. And there's boxed options. You can do rate control, anticoagulation, cardioversion. Check that out through like pure human intelligence. Look at this goal. What I was able to pull up. Any idea how I was able to do this? How many years of practice? I mean, it's crazy, right? Can you just imagine? I mean, years of practice. I mean, she's totally not impressed. I mean, she just thinks it's completely normal. I mean, you know. Any idea how I was with this off?
4 years of medical school.
You know, an MD, PhD, 12 years of training. You know, like right here, you can see right here, like where I was able to do. Yeah, okay. I'm not really sure what to do now. Usually a big stop at this point. Kara might have noticed, like, I actually have. Kara, everybody's laughing. Everybody's laughing because they think she thinks we're playing a joke on her. She's just a baby's delivering life. Just to let you know, we're not playing a joke on you because actually I want you to be the first to see. This entire book has been blank the entire time. Thank you so much, Kara. You're amazing. Let's have another big hand for Kara. Thank you all so much. Of course I memorized and learned all this stuff. You and our patients deserve and should expect nothing less. Thank you all so much. Have a wonderful night.